Hi, this is Diagnosis Bona Corazza Bona, and today we'll talk about 4 conditions: Epstein-Barr mononucleosis, cytomegalovirus infection, toxoplasmosis, and HIV infection. They can have very similar symptoms like fever, fatigue, malaise, and lymphadenopathy. So let's start talking about how we can differentiate them. Epstein-Barr mononucleosis. It's a febrile illness caused by a human herpes virus 4, and it can mimic disease such as HIV infection, streptococcal tonsillitis, viral hepatitis, and acute lymphatic leukemia. There are 3 forms: the febrile, the ingenious, and the glandular. So it affects for 15 to 25 years age group, and in most young children, primary EBV infection is asymptomatic. Clinical features: slow onset malaise from 1 to 6 weeks, fever, myalgia, headache, anorexia, blocked nose, sore throat, anorexia, nausea and vomiting, and rash. Clinical findings are exudative pharyngitis, petechia of palate, and lymphadenopathy, especially posterior cervical, and it could be rash, splenomegaly, jaundice, and hepatomegaly. So, diagnosis: it's a monospot test is positive, and also it could be lymphocytosis and also present atypical lymphocytes. Prognosis, so it usually runs an uncomplicated course over 6 to 8 weeks. Major symptoms subside within 2 to 3 weeks. Treatment is usually supportive, and you can use corticosteroids for neurological involvement, thrombocytopenia, threatened airway obstruction. There are different forms of cytomegalovirus infection, and it's a congenital. It's causes serious abnormalities in the fetus, including microcephaly, hearing defects, motor disturbances, jaundice, hemolytic anemia, and thrombocytopenia, and in 30% of these kids, mental retardation. Cytomegalovirus mononucleosis with fever, malaise, arthralgia, myalgia, generalized lymphadenopathy, and hepatomegaly. However, cervical lymphadenopathy and exudative pharyngitis are quite rare. Disseminated cytomegalovirus infection occurs in the immune deficiency person, and it's caused pneumonia, retinitis, encephalitis, and also cytomegalovirus colitis. Diagnosis is by serological tests, also PCR testing, and virus can be isolated from the urine and blood. Treatment is usually supportive, and just for immunosuppressed patients, it could be used for some antiviral drugs such as ganciclovir, forcarnet, and fomivirsen. Toxoplasmosis. Toxoplasmosis is caused by Toxoplasma gondii. It's an obligate intercellular protozoan infection. The definitive host in its life cycle is a cat, and the human is an intermediate host. Infection in humans usually occurs through eating foodstuff contaminated by infected cat feces. The 5 major clinical forms of toxoplasmosis are: the first one, asymptomatic lymphadenopathy; second one, lymphadenopathy with a febrile illness similar to Epstein-Barr mononucleosis; the third one is acute primary infection, and it can lead to myocarditis, pneumonitis, chorioretinitis, and hepatosplenomegaly; and also Fourth is neurological abnormalities, including headache, neck stiffness, sore throat, and myalgia. And congenital toxoplasmosis, it's a very rare condition, but with a very poor prognosis. Diagnosis is by serological tests to show a fourfold rise in antibodies. Treatment. So for asymptomatic infection, there is no treatment, just supportive. If it's a symptomatic patient or it's a kids, you can use pyrimethamine plus sulfadazine. And also you can use clindamycin for pregnant women. The human immunodeficiency virus, it's a retrovirus and it affects the immune system. So the time for the onset of AIDS or acquired immunodeficiency syndrome in HIV-infected adults varies from 2 months to 20 years or longer. The median time is around 10 years. Definition of AIDS: it's a HIV-positive person with one or more of the clinical diseases that are a feature of AIDS, like pneumocystic pneumonia, Kaposi sarcoma, or CD4 less than 200. There are different stages of HIV, so let's start talking about acute seroconversion illness, and symptoms are fever, night sweat, malaise, lethargy, anorexia, nausea, myalgia, arthralgia, headache, photophobia, sore throat, diarrhea, lymphadenopathy, and other symptoms. So diagnosis will be neutropenia, lymphopenia, thrombocytopenia, and mildly elevated ECR and serum transaminase. And also it could be atypical mononuclear cells, but it will be also inversion of the CD4 to CD8 ratio due to elevation of CD8 cells. So acute HIV, it's a fever, severe malaise, and lymphadenopathy. And also there is subsequent stage, it's after the acute illness, and it could be asymptomatic, but in many cases people have lymphadenopathy. So, and clinical features of progression, it's a chronic fever, cough, chronic diarrhea, oral thrush, and weight loss. You also can read all symptoms which could be for HIV patient in this slide. And tests for HIV infection, it's an antigen antibody test, ELISA screen. If it's a positive, so the next step will be Western blot technique. This test used for confirmation. Management is highly active antiretroviral therapy for pneumocystic cerevisiae. It's a trimethoprim with sulfamethoxazole, and some alternative agents are IV pentamidine or oral dapsone, clindamycin, and primaquine. So this is the end of this video. Thank you very much for watching. I hope this video helped you to understand these conditions, and see you next time.